Pay for it. And don't tell me I can keep my plan, because that man went on TV and he said, hopefully in 3 or 4 years I can phase out all these private plans. That man said that.
Marjorie,
his mouth.
Marjorie, appreciate your question. You look great, and obviously you've taken good care of yourself all these years, and you're.
I try, and my grandmother lived to be 96.
Well, good genes too help,
Yeah,
right?
that's what it is.
Well, anyway,
Hard work.
first of all, the president doesn't make legislation. Just another civics lesson. The Congress does.
People what to do, and you dogs, he's going to twist your arm.
Well, first of all,
don't give in to him.
First of all, excuse me, Marjorie, but I'm an independent-minded person. Always have been, always will be.
I hope so.
And I'm looking at what's best for the people of this country. I have no reason to vote otherwise. I'm voting for what I believe, and I haven't voted for anything yet. So, I mean, we got to get this bill
He wants
right.
the end of 2009.
So,
are you going to vote for it by?
I believe we will have health care reform passed by the end of this year of some sort. I am really tired of people kicking problems down the road. I'm tired of people not having the gumption to try to do the right thing going forward. So we want to make sure it's the right thing. We want to make this bill the best bill it can be. And we've got to move forward. So you can keep what you have, and I know you don't believe me.
No, I don't.
But, I don't know how else to say it. I mean, I can say it a million ways, and you can keep asking me the same question. But if you like what you have, you're going to be able to keep it. If you don't,
No, you're not.
I've read the bill. If you like what you have, you can. Now, the next question.
Oh, you bet. And I didn't know it until I read it in the Times. This should have been published before this morning. But thankfully I live nearby and I could get here. Because I want to come to these meetings. I want her to know how passionate I am. And I want the rest of the government to know.
What's your biggest fear with nationalized health care?
That I'm going to lose my plan that I've worked very, very hard for to keep, and I'm pleased with it, and I don't want to lose it. I don't want something shoved down my throat by the government. They're taking over too much of my life. They're telling me what's good for me. I know what's good for me. I don't need the government to tell me that.